Thomas. We have Thomas today here with us. Thomas is the regional advisor for healthcare workforce and service delivery at WHO Euro. Thank you for joining us. And we have quick questions for you. So the first one, as you know, the OECD has said that the health systems are underprepared, understaffed, underinvested, and on the same line, the health workforce. It's also feeling that they are not getting the investment and the preparedness that they need for the future. So the first question, and based on these great tricky factors that are leading to these feelings, how do we envision a health workforce for today and tomorrow that delivers on its promises?
Thank you so much, Joao, for the question. Last year we launched the report on health and care workforce in Europe, Time to Act. And in that report we are basically positioning that we have a health workforce crisis. And one of the main factors leading to this crisis is an increased attrition of health workers. And the increased attrition is driven by four main factors. The first one is on an aging health workforce. As you could see, we have 13 countries in the region with more than 40% of the doctors over 55 years of age. So that means that in the next 10 years, at least 40% of the doctors will go on retirement. That's the first factor. The second factor is the increased deaths because of the COVID pandemic. It's not big numbers, it's around 50,000 health workers who passed away in the region, but has a big emotional impact in the rest of the health workers and in the burnout. The third element is migration, and so countries are really suffering high migration of health workers. And the fourth element is increased resignation because of burnout, stress, anxiety. We have seen increased absenteeism by 62% during the COVID pandemic. We see that nearly 50% of the health workers have experienced burnout, and all this is making that health workers are leaving the health system and we are getting attrition. So how do I see the way forward? I think we really need to take care of the health workers we have in the system. So the priority must be to retain, to keep in the system the health workers we have. And for that, we need to improve the working conditions. That means we need to reduce the workload because we have huge workload at the moment in many cases. We need to reduce the working times. We see that many health workers are working 60 hours, 50 hours per week. So that's not good for a work-life balance. We need to improve remuneration, fair remuneration. We need to protect the mental health and well-being of the health workforce. So I think if we go in this direction, we will be able to make sure that health workers are happy working in the health system, and health workers will be able to fulfill their passion, which basically is serving patients and making a difference. And in that way, we will also be able to attract the new generations, the young people, the young students into the health professions.
Actually, in the session that you were, in the plenary session, there was this mention about relationships. One of the panelists mentioned relationships, and I think it really links to that, and flexibility. The young people were talking about flexibility, and those kind of working conditions are really important, I would say.
Definitely. Something we discussed yesterday was about compassionate leadership by Michael West, and it is a very good point. This is how leaders really listen, really take into account the opinions, the views of health workers, recognize their work, and they really feel appreciated, they really feel as an important part of the system, which is the reality. So I think that component of compassionate leadership is really critical, and definitely, and the second point you mentioned was on
flexibility.
Flexibility, definitely.
Yes,
I think
the working hours.
The new generations, they really appreciate the work-life balance. They are not willing to, I'm a family doctor, they are not willing to do 8-9 shifts per month and then not seeing friends or relatives or family. So I think we need to find ways that we bring flexibility so people can really adapt. You can really take the work based on how much work you want to, how many hours you want to work per week. So that's really important, I think.
So you've been talking about retention and recruitment, but there was a lot of skepticism yesterday in the session that we can actually do this, that we can actually recruit more care workers. And there was this thought that what we do currently have as the health workforce is what we have, so we have to work with it. And so you had mentioned there are also some other potential strategies that we can also address the challenges of the health workforce, one of which was optimizing performance. Can you touch a bit on that? What does that actually entail, and what are some concrete strategies that countries can do to try to optimize performance?
Very good. I think this is a key point because you are totally right. 2 weeks ago, in the regional meeting on digital health in Porto, the Minister of Health of the Netherlands said, we have money, but we don't have people. So there is a clear challenge that we need to do more and work more efficiently with the limited human resources that we have in order to be able to deliver the services and the increased demand of services that is coming up. So what optimizing performance means is to be more efficient and to do more and better with the limited health workers that we have. How do we do that? I think first element is important to realign processes, to reorganize services in a more efficient and in an innovative way. So that means that probably we need to look at the patient pathway and start looking at wastages and how we can reduce wastage and bring added value. By doing this and by bringing digital health technologies, we can really improve efficiency and make a more efficient use of the limited health workers that we have. And just to give you an example, there's a good paper in the New England expressing how one country in Spain, for example, what they have done is looking at the patient pathway as I was talking, realigning processes, defining well, for example, after hip surgery, what type of diagnostics, visits to the specialist, visits to the GP, when the nurse has to go to the community, to the household of the patient. So you define all those elements that are bringing added value and start reducing unnecessary visits, unnecessary treatments, unnecessary things. And by doing this and bringing digital health technologies in automatic appointments with the specialist, automatic appointments with the GP, with the nurse, in this way we really maximize the time of the patient and the time of the health workers. And they see that, for example, in this case, they managed to reduce 30% the necessary use of the specialist time in order to cater for these services. So there are many examples that we can bring innovation in these processes and bring in digital health technologies. But I think it's important that we put the patient at the center, the process first, and then we bring the digital health technology. Because in many cases, we are just developing new apps, new technology that are not really aligned to the needs of the patients. And that could be a waste of resources and a waste of time.
You mentioned digital technology, and this is definitely a buzzword that's always being used when we're talking about healthcare workers. And what's your view then on incorporating digital technologies? I mean, what role do we have here? You had just mentioned that we can use digital technologies in some ways to try to make processes more efficient. Data aspect, of course, we need the data in order to actually make informed and efficient decisions. But what do we need to do to now bridge the gap a little bit more to bring digital technologies into care workforce?
I think one first important step is to define what are the health needs that we have and how digital health can contribute in improving health outcomes of people. That's the first element. So we need to start by the foundation. Second, in developing digital health technologies, we need to engage health and care workers because they are going to be the ones using digital health technologies. So if we want them to really use them in a meaningful way and that is bringing added value, we need to engage health workers and patients in the development of digital health technologies. Third, digital health technologies have to be simple, have to simplify processes. If they be more complexity, more time to be wasted, at the end of the day, health workers will not use them and patients will not use them. So I think that's another important element. Fourth, I think it's really important to assess the effectiveness of these digital health technologies. In many cases, we are using human and financial resources and we are not assessing their effectiveness. So we really need to measure the effectiveness. And before rolling out these digital health technologies, we need to show that they bring added value, that they are effective, and that they are bringing added value at the end of the day to improve the health of patients. And then the last point I think is really important is to set up at the national level governance mechanisms in order to put all these things in place. So it's not just an initiative coming from one company or one institution, but there should be a clear mechanism, and some countries are going in that direction to define the needs, to define how you put these digital health technologies, how you develop them with everyone engaged, and how you assess those and how you roll out those.
I think it's on one side it's about compassion, it's about relationships, and the other side it's more about time and efficiency and effectiveness than money actually. So I would say that for us it was a pleasure.
Maybe one comment on
Yes.
that, because I think that's a really good point, and I think is the human touch. So digital health technologies can bring added value and can help health workers, but it will never be able to replace the human touch of health workers. So I think it's really important, that element that you bring, so that when we train the new generations in the medical school, in the nursing schools, and in other health professional schools, we need to reinforce that human touch element component. And that was raised in the session, in the plenary session, as yesterday, how we bring this humanism, how we bring this human component into the training, so that when health workers get into practice, they are really looking at these elements and engaging with patients from this perspective, and with other colleagues as well. I think here is very important teamwork, and you need to have that sensitivity in order to be able to work together as a team.
Yes, great.
Absolutely. Thank you so much for your
Great.
time.
Thank you.
Thomas.
Thank you to you. Thank you.